From October 20th to the 26th, join the American Association of Respiratory Care and its members in celebrating Respiratory Care Week. The annual event recognizes the respiratory care profession and promotes awareness of lung health issues and disease. The CDC reports that smoking causes an estimated 90% of all lung cancer deaths in men and 80% of all lung cancer deaths in women. But cancer is not the only lung disease tied to smoking. The U.S. Department of Health and Human Services says that smoking is the primary risk factor in COPD. The American Lung Association defines chronic pulmonary obstructive disease, or COPD, as the combination of two lung diseases, chronic bronchitis and emphysema. Ed Neuzil, registered nurse practitioner at the Allergy, Sinus and Asthma Family Health Center, explains how he treats and tests COPD.
COPD is a reduction, and I'm going to use some terms here that are a little bit different. It's actually measured by spirometry. Now, spirometry is when you go into your provider's office and they have you breathe in this machine and they're actually looking for your pulmonary functions. That tells us how much air did you get out, how much did you get out the first second, and then that ratio is how we measure whether you have COPD, you don't have COPD. And so when we look at that ratio, getting below 70%, normal's 80 or above, when it goes below 70%, that's the diagnosis for COPD. That's an obstruction, okay? So we're not even looking at the smaller airways, we're only looking at the big airways. And when you start obstructing these big airways, you can start noticing symptoms. And one of the big symptoms that you see is shortness of breath, difficulty getting a breath. And although COPD is associated with a history of smoking, smoking is not the only thing that can cause COPD. But anybody that is experiencing the shortness of breath that smokes, I can't tell them how important it is they need to stop like now, because this is a progressive condition if they continue to smoke, and it can get worse. COPD up until now was not considered a treatable illness. We may not reverse someone back to what would be considered normal, but we can definitely impact the decline and improve symptoms.
You can map the location for the Allergy, Sinus and Asthma Family Health Center when you check out the exclusive Hometown Health Specialist directory or click the Respiratory Care Story link on our homepage, yourhometownhealth.com.